Hi everyone, welcome to our October segment of Poderosas to the Front. My name is Nina Serrianne. I'm the Health Equity Policy Analyst at the National Latina Institute for Reproductive Health. I'm thrilled to be here today with Cynthia Romero, Director of Communications at Catholics for Choice. Today we are discussing, we're busting myths on the Latinx views on contraceptive and abortion care and discussing access to these critical healthcare services. So let's go ahead and get started. Cynthia, why is access to contraception and abortion services so important?
Yeah, definitely. Thanks, Nina, for having me, first off. And so it is absolutely important, a service that's important both for Catholics especially, as well as Americans generally. And I think one of the things that I hope we can dig into today is just how women of faith and women of no faith require these services. And especially for the Latinx community, it's important that that we bust some myths about their views on these services and whether they use and need them, and how they kind of feel about the imposition of politics and religion in their access to these services.
Yeah, absolutely. I mean, we know individuals know what's best for them and their bodies and their families. And we also know that the Latinx community and immigrants face additional barriers to accessing these services. So
yeah, definitely. I mean, we certainly see that there is a desire, but we do really worry that within our community, sometimes, like in the case of our community that has more recently arrived to this country, or that lives in communities where there's just scarce resources of all sorts, not just in healthcare, that they find themselves really limited, and that they do find themselves feeling the brunt of policies that limit access to reproductive care more than other communities.
Yeah, absolutely. So we keep talking about busting the myths. So let's talk about what some of those myths are. What common myths do you hear that surround the Latinx community and access to birth control and abortion care?
Yeah, so I think there's one myth that is really important to us at Catholics for Choice, and one is that that Catholics don't use birth control, and it's just not true. 99% of Catholic women who have been sexually active at some point in their lives have used birth control. And so that's really important, because when we think about that 99% of Catholic women, 40% of US Catholics are Latinas. So when we're talking about that number, we're talking about a big proportion of women who who are both Catholic and from a Latino community.
Yeah, absolutely. I know we have a new poll, which is part of why we're here today to discuss that. And we know more than 2/3 of Latinxes don't think of birth control as controversial, and more than 8 in 10 say it's not a religious issue for them. So despite what we hear kind of in the media and in society, we know that that's not the beliefs that people actually hold.
Yeah, so that's really important that you say that, because that's another kind of myth that we see, that, okay, maybe if a Latina, doesn't come from a faith tradition, she is somehow more open-minded about this, and that Catholic Latinas are somehow more conservative, and that's just not true. We see that, again, Catholics of all demographics use birth control, and additionally, that Catholics get abortions at the same rate as non-Catholics. So again, we don't, when we're just carving out the piece of that picture that is, the Latino community, again, we see that there isn't a distinction, and your poll seems to reiterate what we've seen in our polling data, that there is just no distinction between use of contraception and the need for abortion among people of no faith and people of faith.
Yeah, absolutely. So on that note, I was hoping we could chat a little bit about how does religion influence Latinx views on contraception and abortion, and what you found in the great work that you're doing.
Yeah, so I mean, again, I think not only do they use contraception, do they sometimes need an abortion, but we also see that they disagree. The majority of Catholics disagree vehemently with the Vatican's position on birth control. And so one of the things that we've been doing this year at Catholics for Choice is lifting up the fact that it's the 50th anniversary of Humanae Vitae, which is the Vatican's encyclical that reaffirmed their ban on birth control. This happened, again, a half century ago, and we're still living under the consequences for half a century of this policy, because we see how this policy has impacted now religious exemptions that Catholic and other religious right communities are seeking from the Trump administration to carve out exemptions for religious or moral reasons in the Affordable Care Act's coverage of birth control. And what really frustrates us is that not only is this harming access to contraception and abortion that Catholics use and need, but it is completely being sold as something that Catholics want, and they don't want it. We see it in our polling data that 83% of U.S. Catholics disagree strongly or disagree somewhat with the Vatican's ban on birth control. And not only do we see that in the U.S., but we also see that in Latino communities in the hemisphere. So 80% of Catholics in Colombia have never even heard of the Vatican's ban on birth control, and 84% of them think that using birth control is very common. So even in the communities where Latinos are coming from, we see that Catholics are very much in disagreement with the Vatican's ban on birth control and really dislike the politicization of this issue.
Those numbers are really outstanding. Like, when you hear them, again, I feel like a lot of the polling that we've been finding reiterates what people have been saying and the stories that have been told for a long time. But now we have the data to show how people really feel. And when you hear those numbers, it's quite astonishing. I'm glad you brought up religious refusals too. That's something that NLIRH works a lot on. And we've been, in our poll, we were finding that 82% of Latino voters do not see birth control through a religious lens, including 76% of Catholic respondents, and rather they see birth control as a preventive measure. And, as thinking of that and like the data we're getting there, as we're combating all these religious refusals that are coming down from the administration. So I'm glad you touched on that.
Yeah, it's very frustrating because it's being sold as, oh, we're seeking these religious exemptions because this is what people of faith want. And it's just not true. People of faith do not support these religious exemptions. People of faith do not support both the exemptions by executive action, but they also don't support the fact that Catholic hospitals and Catholic healthcare systems will deny people comprehensive reproductive care, including certain types of IUDs, and including abortion services and post-abortion care, including in some instances access to emergency contraception after instances of sexual violence. So these are not things that the majority of Catholics agree with, but they are things that an ultra-right sort of power group within the hierarchy has been pushing for, particularly under this administration.
Yeah, absolutely. And we know, as you listed all of the different ways religious refusals can impact healthcare services, we also know that LGBTQ rights are reproductive rights, and reproductive rights are LGBTQ rights, and we see the ways that these religious refusals are harming our LGBTQ community.
Yeah, I'm glad that you bring that up, because we were really glad to do a video with your organization, with the National Latina Institute, precisely showing the other side of the story of religious refusals, who gets hurt. And that video tells the story of Dion, who was denied birth control coverage by her employer for religious reasons in Chicago, but it also tells the story of a woman who had been doing amazing work for decades in social services at a religious employer, and then was fired because of who she loved, because of her wife, who coincidentally was also a minister in her own Lutheran church. So we do see that the same exemptions are used to hurt both reproductive rights as well as LGBT rights.
Yeah. So we've both been talking a bit about our new polls, which so I wanted to take a minute just to ask you what was surprising, or what of the findings really stood out to you?
Yeah, I think one of the things that stood out to me was that we did the poll. We looked at U.S. Catholics, we looked at Colombian Catholics, we looked at Irish Catholics, Filipino Catholics, and Kenyan Catholics. So we looked at a variety of cultures, and we found pretty striking similarities. We found pretty high levels of disagreement with the Vatican's ban on birth control across the board. I mean, certainly we saw lower numbers in the Philippines, but certainly we saw some really high levels of disagreement, particularly in Colombia and in Ireland, which just goes to show that, again, Latinos are not alone in their views about birth control, contraception, and abortion. We are pretty close in our views to other majority Catholic countries. And so that was a little bit surprising. I will also say that some of the numbers were actually of people who disagreed or who had not heard of the Vatican ban on birth control were actually higher. In Colombia, for instance, 80% of Colombians had not heard of the Vatican ban on birth control, whereas only 48% of U.S. Catholics had not heard of it. So I thought that was a little bit interesting, because I do think, we could probably do more data around that, data mining around that, because I do sometimes think that there's this misconception that that Latino Catholics share a desire to get religious exemptions or to push sort of this ultra-right agenda as white U.S. Catholics. But I actually think what that number shows is that that Latino Catholics, or at least in Colombia, are actually less likely to want, are less familiar with the Vatican's ban on birth control. They're probably less likely to want the politicization of religion and politics. So I thought that was particularly interesting. If they've heard of it, that means possibly that white Catholics are hearing about this more en masse than Latino Catholics, for instance. So I'm always kind of curious to think about that, because I do think that for our community, the social justice teaching of our church is really important. Our community finds itself oftentimes in economic hardship, and understands that women can face a variety of socioeconomic and moral reasons as to why they need contraception. And they understand that people sometimes are living on the edge and don't have all of the resources in the world to which factors into how many children they have, when they have them, and if they have them.
Mm-hmm. Yeah, one of the things our poll demonstrated was how many people are foregoing care for a variety of reasons, but including economic hardship or fear in the current climate with immigration. So yeah, keeping in mind when people, what their economic situation is and how that's impacting their access to birth control.
I worry about that, because we pay a lot of attention to religious exemptions coming out of the Trump administration. But what we also see is that the marketplace is kind of dictating what access to care people have as well, because 6 in 10 hospital beds in America are Catholic owned or affiliated. And we see some of these Catholic healthcare systems. I was recently in Oregon, and you see front and center of the Catholic healthcare system when you arrive in Portland Airport. So these healthcare systems are oftentimes serving non-Catholics. In places where, in Oregon, 12% of the population is Catholic, yet a huge proportion of people are being served by the Catholic healthcare system. And a lot of times you will find Catholic healthcare systems in underprivileged communities and inner cities and places where people have less options and they can't drive to another hospital. And so they find their services are denied, not because of religious exemptions, but because of the ethical and religious directives that dictate what services a Catholic healthcare system can and can't provide.
Yeah, absolutely. I'm really glad you brought that up. So our poll was specifically looking at Latinx voters and was conducted August through September of this year. So it's pretty recent and will be widely available to the public shortly. But yeah, we found a lot of as I said, there wasn't so much surprising data in our poll, but just affirming the stories that have been told for a long time now, knowing that cost and access to birth control has been a recent issue for many Latina voters of reproductive age, as I mentioned. But also it showed, the majority of Latino voters support abortion rights and access. And respondents were saying that they would support a loved one who had an abortion, and half could imagine a scenario in which abortion would be the right decisions for themselves or their partners. So this goes, again, like right with what we have been saying for a long time, but kind of busting that myth that that's not how the community feels.
Yeah, we have also found kind of very similar data. So more than 60% of Catholics believe abortion should be legal. 6 in 10 Catholic voters believe that abortion can be a moral choice. And we find time and again studies, both from our end as well as other studies have been commissioned, that Catholic women have abortions at the same rates as women of no faith or other faiths. So again, when you're looking at, I'm not surprised that your data showed that. And I think that speaks to the fact that if you parse out Catholic Latinx versus Latinx of no faith, you're going to find similar trends. You're going to find people that probably know someone who's had an abortion, may have had one themselves, and at least can understand the real unforeseen circumstances that could lead someone to need one.
Mm-hmm. And I know too, we talked a lot about religious exemptions with employers, and we actually found that 86% of Latinx voters agree that a woman should be able to get birth control through her health insurance, even if her boss disagrees with the idea of birth control. So again, particularly relevant to some of the regulatory things coming down from the administration, but again, showing that how the community feels versus perceptions.
Yeah, I mean, that really worries me because, again, the Trump administration is selling these exemptions as doing them for the people of faith, and in fact, that's not what they want. Mm-hmm. And particularly our community, which fills the pews more than any other community. Oftentimes, you go to Spanish Mass and it's fuller than an English language Mass. And, a vast majority of those people attending are in disagreement with these exemptions because they know that if they go and ask for their tube site after having a child, or they're seeking an IUD, that they may not have time when they're working 12-hour shifts 7 days a week to go to another hospital, that they don't have money out of pocket to pay for an IUD that isn't covered by their insurance. They understand that we're talking about real situations in people's lives where they don't have unlimited time, energy, and resources to seek an alternative.
Yeah, absolutely. So I have a couple more questions. How do you see the results of these polls being used to continue to shift the narrative on contraception and abortion within the community?
Yeah, I think I really hope that we definitely want to continue to partner with your organization to disseminate these findings so that we start to give voice to people that don't have a voice. We really worry from our side that the Catholic hierarchy and religious right voices within the hierarchy, they have a bully pulpit to get what they want and to push their agenda, and it doesn't reflect the people in the pews. The Catholic Church is not the hierarchy. The Catholic Church is the people. And especially we're going to see in America, we already see it, 40% of our church is Latino, and it's going to continue to look more and more, Black and brown. So we need to be able to give voice to those communities that are in disagreement with the hierarchy. It's just not fair that this politics is being sold as, reflecting the views of religious people when it's simply not true. So I hope that we continue to work together to lift up these numbers and say, this is what people of faith or no faith, especially Latinos, really want. This is what these are their views. And so let's stop misrepresenting what their views are.
Yeah, I think, as I mentioned, some of the polling around employer coverage, and again, like we've been as we've been submitting regulatory comments and responding to a lot of these religious refusals, saying like, no, this is not what the community is asking for. And I'm excited now that we have the data to say, like, this is harmful. It's creating more barriers. It's not about religious exemptions. It's keeping people from the care that they need when they need it. And also, we know that there's so many barriers to begin with, especially for immigrant women, that a lot of times just getting in the door of a clinic is hard enough, let alone when you add religious exemptions and, or you said, like you've mentioned, like refusals at the hospitals, as an additional layer of keeping people from the care we need. And also, we know that the Latinx community is the most uninsured community, so accessing care, again, isn't easy to begin with, and especially in a way that's culturally or linguistically appropriate. So I'm hoping the data can help shift the cultural narrative as we kind of combat these policies.
Yeah, definitely. I mean, in addition, as you said, our community is underinsured. And so we also see changes to the Title X funding, so which again, disproportionately impacts the uninsured or the underinsured, those with fewer insurance options, and particularly, Black and Brown communities in lower income neighborhoods. So it is really frustrating that, particularly again from our perspective as a faith organization, that this is being sold as a, it's representative of people of faith, when in fact they're the ones being hurt the most, and especially those living in underserved communities. So it's very, very frustrating. And
I'm glad you bring up Title X, because it's, especially in the current climate where there's so many attacks on healthcare, Title X funded clinics really provide the one space where people can go, people of all immigration statuses and all income levels, can go and get the care they need in a culturally and linguistically appropriate way. Half of Title X patients are women of color, 32% identify as Hispanic. So, when we're talking about attacks on the only federally funded family planning program, we're not just talking about attacks on everyone. We're really talking disproportionately about attacks on Black and Brown communities and LGBTQ patients.
Yeah, this is very, very concerning for us. I mean, our faith is about lifting up the most vulnerable, and yet we find it being used as a sword to deny care to the most vulnerable. And that really, really hurts us and offends us, frankly, because this isn't, our faith talks about caring for your neighbor. And so stripping them of the care, the few options that they have, is just, it's not what most people of faith stand for. But unless we sort of lift up the numbers and lift up the voices of people who are impacted, it's hard to fight against this, because you do have a very organized, very vocal religious right lobby that gets their way on politics a lot of times at the expense of the people who need care the most.
Yeah. So with all that being said, based on your research, where do you see Latinx views on contraception and abortion heading as we talk about culture shift and what we know to be true from the data and all of that?
I think we'll continue to see, additional support for services. But I think, as our community continues to grow, I think we need to continue to see the diversity in our community. One of the things that I really worry about is, making sure that we're reflecting more recent more recent immigrants who are first generation, like I am, and who are Spanish dominant communities. So I think it's really important that our data reflects their views. And I do find, as I said, looking at some of the data, even from the home countries, like Colombia, that, they're with us as well, and our countries back home. I'm from Puerto Rico, and, there has been enormous culture shift on the island over the past 50 years, and just increase access to reproductive care, as we see in the Colombia numbers. There's been a huge shift in Colombia. We now have Chile with legal abortion. We have DF with legal abortion. We have, up to 88% of Catholics in Spain, 81% in Brazil, 72% in Mexico, 70% in Chile all support legal abortion under some or all circumstances. So our region, our hemisphere is shifting, our community is shifting, and I think we'll continue to see that reflected as our voices are heard in the United States.
Yeah, absolutely. So is there anything that you guys are working on that you want everyone to know about, or a kind of takeaway message that you want to share?
Yeah, definitely. I hope everybody checks out the story of the Vatican ban on birth control and some of the polling data that I mentioned. They can go to bit.ly / Vatican birth control ban. And so I hope that people look at the data. I also hope they check out our website and see some of the news story editorials, as well as the video that we did, really speaking to the people who are hurt when the religious right gets their way, including the beautiful video we had the pleasure of doing with you guys, a bilingual video. We'll post that up on our Twitter at Catholic for Choice without the S, so at Catholic for Choice, after this webinar, so that folks could check it out.
Yeah, I definitely recommend checking out the video. I'm so glad that our organizations were able to collaborate on that, and just want to thank you for all the work you guys are doing. As I mentioned, for us, our poll hasn't been officially released yet, so I'm also excited to share with everyone today kind of the top lines before it's been released to the public. But anybody wanting to follow the poll once it officially comes out can follow us at NLIRH on Twitter and like us on Facebook to learn more once it's officially released. So thank you so much for joining us today. I'm so glad to have you on and to hear about the great work that Catholics for Choice is doing. So thank you so much.
Yeah, thanks for having me. Muchas gracias. Abrazos.